That here was a significant chronic disease event at the United Nations, and we wanted to make the people of the Caribbean aware of the conference, make them aware of chronic diseases, and also make our leaders who were going to be attending the summit aware of the fact that their people wanted them to attend the summit and to be engaged in the summit. And so it was essentially, as I said, a sensitization and awareness making and a bit of an advocacy program, essentially using mobile phones. Well, the interesting thing is that in the Caribbean, there's a significant penetration of mobile phones. I think probably in the Caribbean, almost every household has a mobile phone, virtually. In addition to that, we didn't have a lot of funds for such an initiative, and we became aware that this was a very cost-effective approach. Although we recognized that we would need to have a lot of support from other players and agencies, if you will. This whole question of getting the involvement of the private sector, it was really a very interesting and challenging one. So first of all, we decided that we wanted to have the widest possible involvement of the mobile phone service providers. And in the Caribbean, there are essentially two of these service providers. We were able to get both of them to allow us to not only provide the text messages free of cost, but also the responses from the subscribers were free of cost. And furthermore, the analysis of the responses was provided pro bono by the service providers. But then we also felt that there was a need to involve other private sector partners. And so we sought out then the leading health insurance company in the Caribbean. And we made the point to them that this was clearly something that could be to their advantage if they were seen to be participating. We also then, in addition to that, established a relationship and a partnership with the traditional media, because although we had recognized the importance of mobile phones and social media, we recognized the need to promote the campaign using traditional media. We are looking to implement a similar campaign around cervical cancer, cancer of the cervix, because this is a significant problem in the Caribbean region. And we are planning to use mobile phones and social media to, again, inform, sensitize, make our women in the Caribbean and men aware of the challenges posed by cervical cancer.